أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. Assalamu alaikum wa rahmatullahi wa barakatuhu. Good morning everyone and my sweetie. Today I have some lectures about the stomach and about the diseases of stomach and which one medicine is a benefit for stomach. That is medicines and capsules of Lancet, Lansoprazole 40 mg and 40 mg capsules. That medicines is registration of America. Highest believability, ensure repeat pain or relief. Believability from the one dose of 100%. So kindly, and that is the patients of stomach for the problem as a burn of stomach, injured of stomach, and otherwise like some diseases. PPIS with a high believability after the first dose are able to inhibit a greater number of active proton pumps. Profound acid suppressions provide high healing rates. I think maybe around 19% of duodenal ulcer patients and 70% of gastric ulcer patients are infected with H. pylori. The meaning of H. pylori is Helicobacteria. That is a patient is too much, maybe is a 70% is available in here of Pakistan. In patient who requires contains treatments with Lansoprazole, Lancet is a superior for healing of nascent associated gastric ulcers. The treatment with the oral Lansoprazole, Lancet capsule for the stomach, may be a therapeutic alternative to IV administrations of PPIS for treating so peptic ulcer bleeding, PUB, as unconscious as too much of the patients for the ulcers. Sometimes patients has say like that, I have burn and chest, I have otherwise that is a patient's, and I have something like pain of stomach, pain of abdominal, I have vomiting, and I feeling a weaknesses. That is all as a disease of only stomach. Is every time the day 3, 4, 5 times eating food, dinner, lunch, otherwise as a drinking, is all to all is a disease make of stomach, because the stomach is not, he is not strong of otherwise like without the any problem. If you use a medicine, then you have a problem of stomach. Highest believability ensures repair of pain relief. Pronounced acid suppression provides high healing rate. Most patients for H. pylori additionals. H. pylori is a kind of one disease, Helicobacteria. He is an stomach. If you not have other problems, if you have not some disease, then you use a medicine for habit. Like me, example, for example, if I want that I'm very healthy and I'm very healthy and I want some use a medicine and I am small bodies. I think I feeling a weaknesses and I cannot go to with the doctor and I cannot check up to by doctors, and personally uh, I am use a medicine, then I have a helicobacteria, I mean disease of medicine, H pylori stomach. Excellent alternative to IV PPIS for treating perfect ulcer bleeding. No drug interactions with the carbohydrates, so safe for cardiac patients. Surely once convinced does that ensures excellent patient complaints. If you have some wrong complaints, then please go and check up to your stomach and liver, because the 90% in the world have disease of stomach like H pylori, injured, gastrictions, acids. Otherwise, because I am I have not a problem anything, but I am using medicines. I'm use otherwise for the pains, headache, and I have headache pains. Then I am use a tablet without the any requirements, without the any reason. Only I have headache, and I cannot information about that why I have headache, why I have pain of head. Usually only I am can go in the store and I buy a tablet for painkillers and I eating for the headache. Then I am make a patient disease of stomach. If you have headache, feeling weaknesses, vomiting, then please you be must advise with your doctors after to advise and use your medicines. Without the advice, nothing. Do not use a medicine, because if or you without the advice, if you use some tablet, I know that your headache is gone, feeling weaknesses is gone, vomiting is gone, but you know that if you know that you have other problems with your body like kidneys, livers and stomach, then please everything medicine if you use, then without that advice to your doctors, your family doctors, do not use anything medicines. Thank you very much for the confirmations from Dr. Khan, and inshallah maybe I meeting you every soon, every day, inshallah. If you have some questions about the medicine, about the disease, then please you can ask me like that. Thank you very much. Allah Hafiz. Assalamu alaikum wa rahmatullah.